Good afternoon, everyone. I want to welcome you all to Warwick. I'm very happy that Governor McKee chose Warwick today to give this update. Back 9 months ago when I first became mayor of Warwick, I was a brand new mayor. We were in the middle of the pandemic. I had to try to navigate through that. And at that time, there was sort of a void of leadership at the state level. We weren't getting the information that pleased me the way we were getting it. And I felt that we didn't have much input. I reached out to then the lieutenant governor, and he, being a former mayor, you know, he was very sympathetic. We spoke a lot. He gave me his cell phone number, which I still have. You know, and he facilitated a way with weekly meetings between all municipal leaders that we were able to work with the Department of Health and the state government, and it became very successful. So I'm thrilled. You know, I want to thank him for that leadership he provided then and throughout this. So it's my pleasure right now to introduce Governor Dan McKee.
Yeah, thanks, Mayor. And it's great to be here at the Senior Center here in Warwick, and as our tours of especially long-term health care being on that, and of course the Lieutenant Governor's here now. She chairs the long-term health care. We visited all the senior centers in the state of Rhode Island, and this is one of our favorites. So thank you for having us and hosting this today, and I want to thank Rec. Joe McNamara as well, who is with us, and Senator Majority Leader Mike McCaffrey, I believe, is here on the way. So we're here at the Pilgrim Senior Center today to talk about booster shots. And we have a pop-up clinic on site today for anyone who wants to get their shot, if they are qualified to do so. And at the end of the press conference, I'll be heading over because I am qualified to be in the category to get a booster shot, along with Paulette Hamilton, who's our Director of Constituent Services in our office. We'll be getting our shot today, and we're here to encourage people to make sure they do get their booster shot, as well as getting their first shot. We all have friends that have not been vaccinated yet. I think it's time that we just politely ask them to get vaccinated so they can join a growing group in the state of Rhode Island. I think we're close to 87% of our adult population that is one shot in the arm right now. So I heard that Colleen Wright, who's here, a resident of Warwick, is also going to, who works part-time at the Senior Center here, is going to give us a few words today, but also I believe that you may be getting your booster shot as well today. So this is an all-in effort to make sure that the state of Rhode Island is safe. So we want to make sure that every eligible Rhode Islander has the information they need about boosters. And we know that information is key in this situation. So consider this our, a booster blitz today, talking about why we need to get out there and keep ourselves safe. So Rhode Island has led the nation in vaccinations. And I've repeated this a few times, that in March there was a great deal of uncertainty in the state, as you can imagine. It was before we had a lot of vaccine. But we did have a very high infection rate in the state, and we had a very high death rate in the state. Fact is that we actually led the nation in those categories, and had one of the lowest, if not the lowest, vaccination rate. Today, last week, we had, I think, the second lowest infection rate in the state, in the country. We had the lowest death rate in the country per capita, and to the work that has gone on in the Department of Health, along with municipalities like the mayor, has provided with us the leadership, fourth in the country in vaccinations. That's allowed our economy to open up in a real strong way. And Tom McCarthy and his colleagues at the Department of Health, along with Dr. Alexander Scott, they really have helped lead the charge here to keep the state safe. And we want people to know that we're living in a state that's safe, but we still have challenges, and we need to make sure we get the booster shots and other people vaccinated. So as we know, some of the most vulnerable Rhode Islanders have already gotten their booster shots. And we thank them for this important step to stay protected from the virus even longer than the first shots have provided that protection for them. I think it's important to remind Rhode Islanders that who's eligible for a Pfizer booster and who is recommended to receive one by the CDC. So Rhode Islanders who received the Pfizer vaccine should receive their booster shot at least 6 months after their primary vaccine if they are 65 years and older, or live in a long-term care facility, or they are between 50 and 64 years old with underlying conditions. Rhode Islanders who have received the Pfizer vaccine may receive the booster at least 6 months after the primary vaccine series. They are 18 to 49-year-olds with underlying conditions are eligible, and also between 18 and 64 years old who are at increased risk for exposure because of their occupation or institutional setting based on their individual benefits and risk. In just a minute, we'll have Dr. Alexander Scott will provide more details and a closer look at the science behind the boosters. Here's my recommendation. If you're considering getting a booster and want to see if you fit one of these eligible categories, call your doctor and have that conversation and ask your questions. Boosters are safe, they're effective, and they're recommended by the CDC. Recently, I got my flu shot, which I encourage all Rhode Islanders to do as well when I was at Operation Stand Down in Johnston a few weeks ago. I think it's important for people to know that they can get their COVID-19 shot and vaccine on the same day according to CDC guidance. While the main focus of our vaccination efforts continue to be ensuring all unvaccinated Rhode Islanders get vaccinated, we want to ensure that more vulnerable Rhode Islanders who are eligible for a booster get that additional protection as soon as possible. So I want to just turn and then repeat some of our Rhode Island's current vaccination numbers. Rhode Island is 4th in the nation in percent of population that is fully vaccinated. Rhode Island is 5th in the nation in percent of population that has received at least one dose of the coronavirus vaccine. And Rhode Island is one of the states with the highest percent of youth aged 12 to 17 who are vaccinated. Number one, testing, that was before I got here and continued after I was governor. And we conducted the most coronavirus tests per capita in the nation during the last 7 days. To repeat some of the percentages, because I think this is important for the people in the state of Rhode Island to know that those who are getting vaccinated are the overwhelming majority of the people in the state of Rhode Island. 87.4% of Rhode Islanders 18 and over have at least one dose. Just under 80% of Rhode Islanders 18 plus have completed their primary vaccine series, and a little over 75% of all Rhode Islanders are partially vaccinated. And 68% of all Rhode Islanders have completed their primary vaccine series, which is, again, in the top 5 of the country. While these numbers are numbers that we all can be proud of and everybody associated with that work, all our volunteers, our National Guard, our municipal leaders, DOH, FEMA was here for a while as well, we also continue to keep our focus on the number of eligible Rhode Islanders who have yet to be vaccinated. So our countdown started in the mid-200s a few months ago, a few weeks ago back. Right now that number is down to 129,000. And we're tracking this metric closely and working hard to bring that down, which our ultimate goal, as I asked, which I put on the table several months ago in the spring, was to get to 90%. And we will, because of the help of the people in the state of Rhode Island and their support. Now, our focus today is on the availability of boosters, but I also want to discuss the October 1 deadline for the Rhode Island healthcare worker vaccine protocol. Yesterday, members of the Rhode Island Medical Society held a virtual session to discuss this topic. The message was clear. The vaccine protocol for healthcare workers is crucial. Our healthcare workers have to be vaccinated to stay healthy and to keep others healthy. We cannot put vulnerable patients at risk when they come to our facilities seeking care. The Pfizer vaccine is now FDA approved. Just like other vaccines that healthcare workers are required to receive, such as the flu shot and the MMR vaccine. Since the vaccine protocol was announced, more than 5,000 Rhode Islanders in the healthcare field have gotten vaccinated. Ahead of the deadline, we're seeing promising numbers from many major healthcare organizations. Care New England and Lifespan have reported vaccination rates of over 95%. And we expect that to grow. That's good news, and there's still time to get vaccinated. The Department of Health has reached out to individuals with opportunities to get the J&J shot, and they are working with organizations on their corrective action plans. We'll have a corrective action plan for both Eleanor Slater and also our Vets Home, which thankfully our Vets Home has had, I think it has had no infections since for the last 3 or 4 weeks. Because Simeon keeps me posted every week on that. We know that it's the right thing to do to keep Rhode Islanders healthy. And I want to thank everyone who stepped up early to get vaccinated and who has taken the time to talk to their colleagues and friends. We will all be safer and healthier because of your decision, advocacy, and care.